What's up, guys? It's your girl Tucson Paris. It is time for my first lipo massage. It's a pre-op lipo massage. I should have got these done at least really 24 to 48 hours after I had my surgery, but I had to do a few YouTube videos to just really gain knowledge on the importance of getting these massages because my doctor did not educate me on how important it is to get these. So I am a week and like 2 days out, so this will be my first massage. We'll be recording everything. The massage therapist, she'll be discussing how this is so important and why it's important and giving you all the knowledge you need. So I'm so excited about this massage. Stay tuned, guys. I'll meet you on the inside. Good. So my concerns right now is I do feel like tension in my stomach because I had lipo in my stomach and tension in my back and the sides. It feels like the skin is kind of tightening on its own, so I just want to kind of rub some of those things out. And then if there's any fluid that needs to be drained out, that too. He did do incisions with stitches, so I have like the stitches and stuff still on there.
They go into, okay, so he did up in the upper arms?
My back has it, up my upper back, lower back, and then my buttocks area. And then I have an incision in my belly button, and then two right here, I think. Yeah.
Okay, and so the drain, did you have drain tubes at any time?
I don't have any drain tubes. I just drained for like the first day on like those dog pads. And I had a lot of drainage that did come out, especially in my lower back, because that's where he did a lot of lipo. I filled up like 3 pads in that day.
Yeah,
day and a half.
sometimes they put a little tube in there, like a tail,
Yeah.
for it to drain, and sometimes
Yeah.
they'll have the bulbs, and then sometimes they don't do anything.
Yeah, I
Just
didn't
let
have
it
any.
just kind of push everything towards there, and it naturally comes out. And then sometimes they stitch them. So everybody has a little different techniques.
I noticed that. I was like, okay. And then for after like the post-op care, I just wanted to continue to come back just to keep everything toned, to reduce like cellulite and just keep my whole body toned.
Okay, great. All right. And that 10% has to be picked up by the lymph. And so by moving your shoulders like this, you're articulating clavicle bone, so you can move it alternating together, forward and back. But that stimulates lymph from the toes. And so there's the inguinal lymph nodes in the upper thigh. Then there's these 2 lumbar trunks that come up here deep in the waist. And the digestive tract is eliminating the purified blood from the waist, and they join into the sternochyly, which is above, just a little left of the navel. And then it goes up this thoracic duct, and it dumps to the heart. So that's why we say if anyone has heart failure, they can't do lymph drainage because it moves so much fluid, 20 to 30 fold the amount of lymph is stimulated with this procedure. And then breathing. So then we work with abdominal breath. So massage a lot in the abdominal area to push everything towards that. Okay. Everything goes up from the navel to the breast, to the axillary nodes. And then below that, everything wants to flow down. So when people have a tummy tuck, they kind of take this and bring it down here and stretch the skin. So, but we still want to cross the lines.
Do you have to massage a certain like way to remove all the fluid, or is it like a technique to?
It's a technique. The German technique's a little heavier handed than the water technique, but it's a still modified water. This is a Chaps watershed. So it goes around the glute, so you can actually see these lines clear up, like if there's bruising.
Oh wow!
And that you actually see it kind of start to dissipate that way.
Awesome.
But it's that way. If someone has had lymph nodes removed, you can bring the fluid from the arm over across, And you can also bring it down.
Wow.
So you can manipulate that.
There's so much to the body. It works for me.
Do they like their teacher?
Yeah, they do. They do. It's just so different from them, like, interacting, you know, in person. One of my daughters is having, like, more of a harder time because she's more, like,
Sociable.
energetic, yeah, and sociable, and she has eczema really bad, so the homeschooling has definitely affected that.
So if I want to follow you on Instagram?
On YouTube, I'll write all that down for you.
Okay, great. I'm just bringing this top quadrant up to the axillary nerves and just doing stretches. Your skin feels good. I was doing some clinical research for lymphedema product, and the guys developed a device for measuring fluid in the tissue. So I'm like, I need one of those. That way we can you just hold it and it measures on a scale, and so that would be kind of neat to know how much fluids loss there is in the tissue each visit.
I love that's what I love. You're doing like the research and you're giving people like information and results.
Oh, good.
You know.
Yeah, there's a lot of supplements that I find is very beneficial. Bromelain is very important for helping reduce inflammation, but it prevents scar tissue and fibrosis, and it dissolves old scars. And quercetin is a very good anti-inflammatory. Sometimes they have a combination of those two ingredients, or you can get them separately. Karen Hertz, Dr. Hertz said quercetin helps prevent fat deposits, so with a BBL, maybe just do the straight bromelain, because you don't want to not have your fat take.
Exactly.
And then there's the Lymph Tonic. Red root is very important in the sense that it acts as a magnet and it draws extracellular fluids from the tissue into the lymph. That way it's attracted. And then the horse chestnut seed extract for people that have a lot of water retention and say like they have a really tough time in their monthly cycle where they really blow up and have that. They just seem to have fragile vessels, capillaries in the veins, and so that helps to strengthen them, and that's proven to reduce edema, and it was mostly used for varicose veins and edema, but we're finding it's beneficial for a lot of other edemas. I take that because there's this.
So you said red root?
Red root, horse chestnut seed extract, bromelain.
Some people that hurts. I'm like, it doesn't hurt. It's just like, oh my god. Yeah, you definitely have to get massages, I think.
Yeah.
Does that hurt?
It's just, it doesn't hurt. It's just tender. Yeah, it's just.
And it gets better over time.
Oh god.
ALL, I want to say ALA, alpha lipoic acid, that helps with nerves. So, because all the nerve endings have been separated with the liposuction, it helps with the pain and the regeneration of that. It's good for diabetic foot neuropathies, sometimes even head injuries with people lose their sense of taste. It helps regenerate the nerves. It's very, very beneficial. So all in between, I'm going to gracefully flip. Okay. So again, from the navel to the rib, all of this tissue wants to come up to the axillary nodes underneath the armpits. And all in between the ribs. So you're really very swollen. And here you've got a lot of shrinking to do yet.
Still more shrinking there. It's so weird when those knots come in. I'm like, what's this? I usually just get in the shower and just let warm water just...
Oh yeah, you gotta be careful.
Oh, is that bad?
It's the warm water, hot water will make the blood capillaries dilate, and that increases edema. So water binds to the blood, and so if you're increasing circulation with the heat, you can contribute to more edema.
Oh, wow.
So if you do warm, try and do lukewarm.
Okay.
And then use a cold shower head and just kind of rinse the surgery areas so that stops the vasodilation, shunts the blood away from, and the water away from the area. Okay. Yeah, you have to be careful. Just avoid heat.
Avoid heat, guys.
And I had a patient who had had a full body lift. They go all the way around 360 with the incision. And she was healing beautifully, but her backside wasn't. And I'm like, I don't understand why these incisions aren't closing. So it turned out it was winter time and she was using her seat heater in her car.
Oh, wow.
And so it was just making too much edema in there, and it just slowed down the healing process. So once we figured it out, we said, okay, cut that off. And then her husband teased her. You know, I got my seat heater on. And
I love seat heaters.
and then it healed all the incisions, closed really nicely.
Who would have thought?
So it's
I thought the hot water helps. I'm putting it on super hot. I'm like, yes, this is so good. Don't do that, guys.
I'm hitting all the lymph node bundles.
I did notice, like, if I'm on my feet too much, just doing things around the house, because it's very hard for me to, like, sit down. My feet feel like they're, like, swelling all the time. And this is just after the surgery.
Yeah, it's just gravity. And then I've had people wear their faja and then their knee socks, and then they come and say, oh my God, I've got old lady knees. Because the fluid was just trapped in between there.
Yeah.
So if you wear compression, you want to go all the way.
So go past
until the swelling goes away, you know, currently post-surgery.
Okay.
So it just...
See, I have compressions, but I didn't know if I'm supposed to still wear them. Or
the longer you wear them, the more secure and the more it activates. And after lymph drainage, it helps keep the lymph system activated longer. Okay. So the pressure's a little different. German technique's a little more firm. People say it's more comforting, but it doesn't hurt. Nothing should hurt. Yeah. If it hurts, you know, back off. Yeah. And It's like pressing on a sponge. It goes squish, and you let go, it soaks up more.
Exactly.
So it's a mechanical in that sense. And so manual lymph drainage is just by hand technique.
Okay.
And we use the direction that the lymph flows upward.
I would have never even known how to. I would have, because the place I went to, they said, you know, you can do these yourself, and I'm like, well, where do I start? Like, I don't know, how do I do this? How do I?
Right. And I don't think you can really do anything wrong except for taking hot showers.
Yeah.
Yeah, and using heat. So yeah, just bringing everything upward. You kind of you're pulling the anchoring filaments that suspend the lymph capillaries.
Okay.
And so when you tug those, it opens the flaps. So the blood has 3 layers, and it takes a lot of arterial pressure to force and enzymes to force that blood through to the tissue, and then it has to go back. So the arterial pressure is greater than the tissue pressure. The tissue pressure is greater than the venual pressure in that perfect world of balance.
Mm-hmm.
We call it Starling's law of equilibrium. But when there's edema, then the tissue pressure changes. And now there's less resistance, so more blood carrying water goes into the tissue, less tissue pressure to push it back to reabsorb. So that's why it's so important to wear the compression. And it just helps with that. And it's especially flying, you know, people experience a little bit of edema when they fly because there's less atmospheric pressure.
Okay.
And scuba diving, there's more pressure. So swimming, when you're in the water, you have the pressure from the water. So that's good.
Okay.
So I had a patient who ended up with a lymph node removed for her female organs. And they'd gone to all the doctors and they had said, you can't do this, you can't do that, you can't bicycle, you can't run, because that creates too much circulation and overloads the lymph system that's already taxed. So she goes, tell us what we can do. I said, take up scuba diving. So that's what they did. They went all around the world on their family vacations and scuba dived. So that was conducive to her condition.
Exactly.
She eventually got lymph node transplants, and just a couple of years ago moved out of state. But I stayed in contact with her. It was successful.
That's great.
They took the ipsilateral lymph nodes from here and put them here, and then a year later they imaged them and said they did connect.
Wow.
And then
like the technology and knowledge these doctors have, they can just do anything.
Yeah, that's crazy.
Yeah. Okay, so now I'm going to go a little deeper, and my intention is the digestive tract. Massage the colon. So we work with the descending colon first. And if it hurts, let me know. So I'm just kind of hooking and pushing towards the navel. And I'm going to flex again towards the navel. So the systemic chyli is about here. Sometimes it gets pretty full here. So we just kind of massage that lumbar trunk from the legs to the navel area.
So these help in general too with the device they're sticking so far in your skin. Does that leave anything like internally, like not maybe scarring, maybe it does, but
well, it causes inflammation.
Okay.
Because they're separating the kind of like the fascia. So there's fascia between the skin and the fat and the muscle, muscle the muscle, and muscle the bone. So there's all different layers of fascia. And when they're going in, they're kind of going between that skin and the fat and the muscle. So that's that area. So when they're sucking all that out, then that has to reconnect. And so the splinting process is that all these fibers lay down to repair, Your body says, oh, it hurts when I move. And it says, well, we're going to set this web out. Don't move.
That's what I'm feeling.
But after a while, you want to have that to release, so you have that natural freedom of movement. And that happens with muscle damage and repair too. So the muscle wants to contract and lengthen, and when you have those fibers that come in and repair that tie, it's like a spot weld. So when people massage and break that down, they get more layers to go, so you have function. So we want function back in just the skin and the movement, mobility. So it doesn't feel so stuck.
Everything she's saying feels like how I feel. That's what I've been complaining about.
And it's
why
crazy.
does it feel like this?
But that Wobenzyme is a German bromelain, and there's lots of research on that. I had seen my first patient that used it had a mastectomy and several transplant surgery, reconstructive surgery, infection, and assault and a redo, just an assault after assault. And so the tissue was very stuck and shiny, and she started doing that and doing more alkaline based diet. And each week I'd see her and I said, wow, it's really changing. She goes, well, I don't see the change because I see it every day. And I said, no, I'm seeing the color of the tissue is turning back to normal. And then I would see the scar tissue is thinning out. And then the lymph vessels were able to respond and stretch in that tissue. You're tolerating that very well. That was a little deep. So I was saying how the blood capillaries are 3 layers. The lymph capillary is only 1. And then they attach side by side. So when you pull it, you open the door. So large amounts of fluid, large macromolecules, metabolic waste, the garbage. The lymph system's the garbage collector. So when you stretch the skin and kind of push, you're opening the doors and pushing the fluid in. So there's techniques.
Is that so that was like an alkaline, like water? Are you saying
alkaline water?
That's like better
and
for repairing
foods that have that more alkaline based pH.
Awesome. Now, what do you recommend for someone who got a BBL? I didn't get a tummy tuck, but you can give your recommendation for that too. But for mine, I just got a BBL and I did get a lot of lipo everywhere. What would you recommend for massages? How often should
They can be done up to, 24 hours after, but we always want to wait for the doctors to have your follow-up exam just to make sure he's happy with how everything went. And make sure there's no infection. But a lot of people take prophylactically antibiotics just to lower the risk of infection. And so acidophilus is very important to take when you take antibiotics to restore your gut health, because they say it's like a A-bomb goes off in the jungle and it wipes out the flora.
Oh, wow.
So you have to reestablish that with the good probiotics.
Okay.
And usually space that out. Whenever you're taking the antibiotic, if you take it once every 12 hours and every opposite 6 hours, you want to take the antibiotic or the probiotic to help reestablish. Give it a little chance to grow before you wipe it out. Let it grow, wipe it out.
Got it.
But I worked in Health South as a transcriber, medical transcriber, and anytime they prescribed antibiotics, it was automatic. We had to prescribe Bassett, Bacillus,
I think what they gave me was a Syphilis, and I take that 4 times a day for my antibiotic. Today is my last day.
And the bromelain you take on an empty stomach because you want it to you don't take it with a handful of vitamins because it'll digest the vitamins. And you take vitamins with food. So you want to take it on an empty stomach so it goes past the stomach into the digestive tract, into the bloodstream, and then it goes everywhere. There's inflammation, the joints, the tissue.
What are
the
some
scar
good
tissue.
vitamins that would work for just recovery of the body?
Oh, people take whatever.
Just like
They're
basic,
regular. Yeah. I just would back off on anything that makes your gums bleed when you brush your teeth.
Got it. So, getting the massages done, how often would you recommend?
In the beginning, you can do it as often as, well, I'm going to have you breathe. We're going to take 10 deep breaths. Okay. I'll count. Don't worry about it. As you exhale, I'm going to press. Okay. So it's like wringing out the sponge. Okay. So it's real important. All right. And it's using the diaphragm as a pump. That's going to shoot the lymph up towards the heart. Okay. And on the way, it's going to go to the kidneys. Okay. Okay. So I'll talk while you.
All right. Got it.
While you breathe in through the nose and out through the mouth. Okay. Now let's see if I remember what the question was.
How often for massages?
How often? Okay, so on the, some people go to Colombia, Mexico, Dominican Republic. Their doctors recommend when they get back to the States, do 5 days in a row to get lymph drainage. And then other doctors say, well, you can if you want. Other doctors say 3 days a week. Okay, breathe again. 3 times the first week, 2 times the next week, maybe 2 times the following week, and then you get to once a week where you feel normal and you feel like you've got control over that. And then I'll do different things each time. Breathe in again. Exhale. And 2 more. You got good strong abs. So 1 more breath. Okay. Great. And that brings everything up here, so we don't want to feel dizzy. Anytime during the day you can massage your neck. And the more often you do the lymph drainage, it creates a muscle memory for the body. So it remembers, oh yeah, I'm supposed to get excited and start pumping more fluid. And a way you can tell it's working is you'll get goosebumps on your body.
I had goosebumps, guys. I swear, I was like, I had them.
I've had people say,
He knows what
I'm
doing.
vibrating. Is that normal? And I said, well, no. These are, you get to take these gloves home with you.
Exfoliating gloves.
Exfoliating gloves, but they're also lymph stimulating gloves. And when the body's reattaching, the skin's reattaching, you've got that itch. And it's like, this kind of satisfies that itch.
Without itching.
It's like, oh my God, it feels so good. So I'm going to have you cross your arm in that way. How does that feel?
Really good.
And it doesn't, you don't have to use a lot of pressure, but it's kind of nice. You can do the 2-handed technique. So I kind of just rework everything. Bring everything up this way. I stay away from the booty. We can bring it from the navel down, and the genitalia area. Sometimes that gets very swollen.
Yes.
So you want to bring that down to the
ever. I thought, like, I went to the doctor, like, what's going on? I did that in my first vlog on YouTube, because I let the girls know, I'm like, look, don't be surprised when you look like a man.
Oh my
here.
God.
Because the compressions, when they put
Yeah,
that,
they have a
that
cutout.
hole.
They have a cutout.
Oh my
And
God.
so that tissue is the path of least resistance, and the blood goes right there.
That was probably one of the most like painful things from the surgery. Like
And can you imagine getting on a plane and flying from Miami?
I don't know how
Oh,
they do
dude,
it.
we talked about that.
I'm
We was like, how do they?
How do they do it?
But that's why I was like, most of them probably stay a week, 2
To the
weeks.
recovery homes or
Yeah.
I don't know.
Yeah. Oh.
Because the swelling was so bad.
Sometimes
I couldn't believe it.
if there's I would say make these chip bags. These little your little makeup triangles.
Oh, okay.
Okay, you get those and you cut them up. Cut them up into little pieces. And if you have fibrosis, where it's like the little thickening of the tissue, all the little corners underneath the compression make little dents, and it breaks it up. But I would say cut these up, put them in a sock, a thin stockinette sock, and you can put that right there.
Oh wow, that would help.
And it adds pressure.
Yes.
Put on your underwear.
That and then the thing they stick down your throat when you're asleep. I had swelling from the
Breathing
Trachea?
tube.
like what's the little thing?
The
you
breathing
got?
tube.
The breathing tube they put down there. What is it called? I can't know the specific. It starts with the U.
Right, for the tonsils.
Yeah, the tonsil thing. It was so swollen. So like between that and the swelling down here, it was like, oh my God.
So throat coat tea is really good for that scratchy throat and that little cough that sometimes from the irritation.
I had bruising in my throat, everything. Cause
Gosh.
I mean, when you really don't ever get surgery, you're just not used to even. It was like, wow.
Yeah.
So that's what I was in pain a lot with those two things, but.
Pump. And then breathing with the diaphragm. And the shoulder circles.
Okay.
To get everything up back towards the heart.
Okay.
I have a question. So as far as like workouts, like in the gym for these ladies that get BBLs and stuff, when should they go back to the gym if they are those type of ladies?
Well, if you don't overdo it, because I have a gentleman who'd had lipo, and he was a personal trainer, so it's really hard to keep him to be still. And so he just has to pay attention to his body. If he feels too wiped out, he knows he has to back off. So you don't want to, increasing the circulation increases the amount of blood that has to be filtered by the lymph.
Okay.
So if the lymph is overloaded, you don't want to continue to create more overload.
So basically working out less is better?
But
Whatever your body.
less, yeah, you have to pay attention to your body. So if someone has a tummy tuck and they go in and make an internal corset, they have to wait a lot longer before they start doing sit-ups and crunches.
Right.
But if you're just having the liposuction and those muscles haven't been tied up in a knot, then you can do that much sooner.
Yeah, I did watch some videos on YouTube. They were saying it's important to like feed your fat so that you don't lose the fat from the BBL fat transfer. Because some girls.
Well, you can't diet. You have to continue
diet,
to eat fat because you want that fat to stay, because there will be a percentage of loss. So you want that to be minimal. So you can't diet. You got to keep eating all that good butter.
Keep eating, guys.
Stay away from the breads. Stick with the high-fat ketogenic diet. You can put the butter on the cracker once in a while.
This massage is so worth it, guys. This is important. I can tell you, based off of the way my body feels now, it is important to do this. You can't do all this yourself.
No, and it feels good. You
yeah.
think, oh my God, it's gonna hurt. Nobody can touch me, but it actually blocks pain receptors.
I agree. I agree.
And signals the pleasure
I was
signals.
really nervous. I was like, oh, I hope this doesn't hurt, because it was just so tense. Every single thing. Sleeping, I can feel the knots. I can feel my skin kind of going back.
Yeah, and that's why that ALA helps, the alpha lipoic acid. It helps with that electric shock of the nerves firing. Yeah, so there's supplements are good.
So with massages, I didn't know, but you would suggest like kind of just booking your massages ahead of time, kind of something like that.
Yeah.
When you know you're getting your day of surgery. Okay.
Yeah, it's nice. Sometimes we'll just set up
Schedule.
3 weeks worth.
Okay.
That way you kind of have a set pattern. It's easier to remember if you have a set schedule. But some people just book it online according to doctor's appointments or kids' appointments. So I feel a little bit of fibrosis here. Do you feel that?
I can feel that.
And I can do a little ultrasound on that, and that helps. Causes cavitation. It's like a cave in the side of a rock. So it bombards it with sound waves, and it breaks it up.
Okay.
And then the body dissolves it.
Now, if you get that and you don't take care of that, what can happen? Was that something that could be like a permanent knot, or is it something that's always going to be painful? Because it's painful.
It's painful. The bromelain can help dissolve it if you don't want to touch it. If you don't have the resources to do those things. Yeah, it'll just kind of feel stuck. So I'm just going to put a warm towel. Oh, that's great. Thank you. A warm towel there. And the gel is not going to feel good. So this is a 1 megahertz. My other ultrasound machine is at 1 megahertz. That's very deep penetrating. This gets to the fat. And the 3 megahertz is very skin deep. So sometimes right after surgery, you're only going to do with the skin. This is a little deeper in here, and you're further out from surgery. How many weeks now?
It's like a week and maybe 3 days.
A week and 3 days? Oh, you're actually healing very well.
The 9th was so
there's the 18th.
Okay.
18th, yeah.
So you'll be too tender to do any vacuum mobilization on it, and then you use the radio frequency to tighten the skin. So once it shrinks down and you want to tighten the skin, then you need to use that. So today we'll just do ultrasound.
Okay.
And
tightening the skin later on, that helps prevent cellulite and
it just makes it kind of shrink.
Shrink.
You know, because it's stretched out a little bit from the swelling, but it was also maybe stretched out a little bit from the fat before, or for previous pregnancies, things like that. So it's room temperature. It's going to be cold.
Okay.
But you can feel a little bit of that dimpling or little nodules in that area.
Yeah, that's the area I was feeling this morning.
Okay, it's all right. It's going to be cold.
Okay.
I'm going to spread it around there a little bit. We haven't done anything yet. It's just cold.
Oh, let me take these out. I can hear that in my...
They, this one has a little high pitch to it. Ooh, that's too much pressure?
Yeah, just a little bit.
Okay. And it's cold, so you don't have to put pressure on it now. It just is going to glide, and it has the sound waves that bombards the tissue, and it helps it to dissolve. Some doctors say only do it by hand. But what I found is that if you break up these little nodules early on, it's just the tissue is better. It heals nicer, smoother. You don't have the lumpiness. I've had people from Colombia and they go, "Oh yeah, you do ultrasound? I'm coming to you because it makes a big difference in the healing process."
I noticed a lot of girls would do the ultrasound that were on YouTube that got in Miami. That most of them in Miami.
And I've got some research on it too, abdominoplasty and ultrasound. And this helps take away it helps with nerve pain, so it helps take away that sensation of the firing nerves too. And we'll listen to your body. How are you doing?
I'm feeling good.
Okay. And if it becomes annoying, you can say, okay, that's enough. So you don't have to suffer through it. But sometimes the doctors get real aggressive around the waistline, real aggressive in the lower area. There's some lumps.
I think there was like one in this area.
That's probably the sternocleidomastoid. But I feel a little bit there. So the trick is you got to keep moving it. And you have to have gel. And it sometimes takes a few minutes to heat up the tissue, but you don't want to burn it. But I call it the magic wand, because you get immediate results.
I feel immediate results. It just feels good with something rubbing on it too.
Yeah. Now later on, when you can tolerate it more, I'll do more aggressive massaging with it too. That I'll work with the way that the colon runs, descending colon and that. So I can utilize the lymph drainage techniques with the machine. You feel that up around the ribs. And having such a big head, you can cover a nice big area. And before you know it, you'll be like a magazine model. With the sculpting, it's amazing. Did they do the 2-step procedure with the Lipo, or was it the one? Because they'll do it with the ultrasound. They'll go in after they do Lipo, they do ultrasound, and it heats it up so it makes the skin nice and tight. It's like they do it twice.
Yeah, no, I don't think. I was only in there like for 3 hours then. Yeah, it was like a 3-hour thing.
Oh, this is really heavy. So I feel a nice lump there. I'm just going to spread the gel around. Ooh, it's cold. I could heat it up, but it keeps the skin from getting too hot. So it acts as a nice cooling barrier. So I do circles, and then I'm working with the digestive tract. So you have your ascending colon, transverse, and descending colon. So it's helping assist with the lymph. And it's the lymph system and the lacteals of the digestive tract that transport fat. And it gets it towards the spleen. So I think it's very important to do transports it to the liver. So to do a liver detox is liver detox, like the everyday detox tea. Some of them has dandelion, which is a natural diuretic, and then schizandra or lemon. But I like the traditional medicinal teas. I think they taste good, and it's just.
I have it's like called Artica. think Artica, it was like, when I bought like all my BBL stuff on Amazon, it was like a suggested tea, or they have like the medicine form, the capsules, like the creams, the tea. I was already taking so much medication after surgery, I decided to do the tea. But it helps like restore, I guess, after surgery and stuff.
Good. And I'm using a little more pressure. How's that feel?
It feels okay.
Okay. I'm
It feels like it needs to be done.
gonna hit this spot right here.
It's just funny, that those are the areas that I was feeling myself, the same exact areas, and I'm like, these knots, just didn't feel right.
And it could just be an enlarged lymph node. Sometimes they get the size of walnuts, the size of almonds, the size of peas, but they're just metabolizing stuff. They're the garbage collectors and the filters. But yeah, right there is but it helps it to shrink down.
Yeah, that was the main area you was worried about.
And again, it helps with the nerve pain and that weird sensation of the skin. It starts to feel more attached. Feels a little better. You can feel it. Go ahead and touch
I
it.
can feel it internally too. Oh yeah, see that knot. That's so, yeah, those knots right here, babe. You see that knot?
Surgery garment. And I said, you're just taking on the shape of your garment. You need to have it get smaller and smaller. It's, when they have those hooks, you're on the first rung of hooks, and the second and the third, and then once you're past that, time to get a new cream. This is paraben free. It's a body contouring gel, and it's caffeine. And I like this product, Alchemy. It's a professional grade. It has seaweed in it. Are you allergic to seaweed?
No.
Okay. And so seaweed helps the skin to tighten. And then what's nice is that it has a nice slickness to it when it goes on. And then it gets sticky. So it's great for doing more lymph drainage. And then it dries powdery so that you can put your garment on and not have it get ruined from the oils. Feels better. I mean, it feels.
Oh yeah.
You still have a lymph node that there's lumpy, so don't worry about that. That's going to go down. The sides. That feels better already. There's still a little bit there, but it's going to dissolve, and your body will carry it away. Pumping the rib cage, so all in between the ribs are lymph nodes. And it helps with sensation feel a little better, tolerating better.
Yeah, it feels sometimes better. I couldn't have done this myself. You couldn't have even done this for me.
I know, I was thinking the whole time, like, a lot of this, I give you massages, but I don't know what she's doing.
Yeah. Oh, I've been doing it 23 years. I went to Germany and got my second certification.
Oh, wow.
So I do both the bandaging techniques for lymphedema as well.
So did you just go there just to go study just for that?
Yeah, it was the first English-speaking course that they offered, and I felt very fortunate to be able to participate in that. We paid a little extra, and they prepared cadavers for us at the University of Zurich. And so we went to Switzerland for the day, and the anatomy department, and they had a nice lunch on the cobblestone streets.
Oh, wow. Yeah, when I went to the other plastic surgery place, they're like, yeah, all of our girls, we We usually have them go 24 to 48 hours after the surgery, depending on how they feel, to Our Lady. And they were kind of confused, like, you didn't get those? I'm like, no. Is it too late? They're like, no, go ahead, go get an appointment. Okay.
Oh yeah, and then I hear girls that are in Mexico City, Colombia, and they're like, it's like a torture chamber going on. People are crying, and they're squishing all the fluid into the holes, and they're very aggressive.
That's what we watched.
So I'm not like that, because
it was just coming out when we were watching.
Yeah, but they will do that a couple of sessions at the surgery center's recovery process. But I don't do that. Once in a while there might be some leakage, and if it's still oozing, I can massage towards that opening. So now see how it's getting sticky?
Mm-hmm.
Now I can stretch, and the lymph capillaries just kind of lift a little bit out of the way. Then I get more of a sticky stretch. And it pulls open the flaps of the initial lymph capillaries to open the doors, so lots of fluid and large macromolecules get into the lymph system to be transported. And you stretch the skin, and it gives that spring back to the skin that's been stuck. We have a nice, you're gonna look awesome.
I can't wait. I think it looks really good now. Just my flanks. I'm sure we're gonna have to go back and do some revisions. Cause I have a lot of, like, my biggest area that I hated the most was like my flanks and my back. I worked out, I tried everything, but they would never go away. It was always just that extra bra underneath. And
so what I'll do is, once we finish here, I'll have you stand up and lean over the pillows, and I'll do your back side.
Okay.
Look how much stretch you're getting now. It's awesome.
And I believe, hopefully I'm correct, they were saying that these kind of massages help if you wanted to do another round, or like I want to do one more round to accomplish just the body that I really wanted. And they said that a lot of girls lose the elasticity in their skin of why they can't transfer as much fat. So if you get these massages on a regular, then for the round 2, it's easier for them to go in there because your skin is more elastic to fit more fat.
Yeah. Well, I know I do pre-op. Prepares the body. It prevents a lot of bruising. I didn't see any bruising. You're all cleared up. The arnica helps with that. Yeah, pre-op makes a big difference with that. Like when I had patients that were having reconstructive breasts, and they put the expanders in, they're like, whoa, you took way more fluid than we had expected because we had stretched the muscle or the tissue and that had been.
Okay. So you can get these massages just to prepare your skin to be more elastic. Okay.
And prepare the lymph system for the onslaught of the edema that's going to occur. Okay, so let's do a few more deep breaths.
Okay.
So it's a big change in everything already. Hip bones. And 2 more. Okay, so now we'll Like, see, they went in this way, like this, around.
There's this place in Miami. Well, there's a few places that do that surgery with the girls up. Like they're not put to sleep.
Oh yeah, a lot of people, they don't. They just use local.
So with that with the anesthesia, is that like an epidural? Because they do lipo on top of your back. So how are they not feeling that?
They probably have an IV. I don't know. I haven't been in the room. Probably an IV with the medication to kind of put them more in twilight.
Okay, got it.
So they do have some medication, and then they put some kind of solution that might be numbing.
Numbing. Okay, got it.
In with the tumescent. Yeah, I used to have a lot of fluid in here.
Okay, so I do have fluid.
You have a lot of fluid
guys.
here. Oh yeah, you're so.
I was being a crybaby,
Very
like, why do
swollen.
I still see flanks?
And water's very heavy, so don't get discouraged by standing on a scale. Don't do that. And it takes, oh gosh, I'd say at least 2 months before you start to really see a good shape.
Okay.
You got a little bit of remaining bruising here.
My butt, like one side of my hip and butt is what took all the bruising.
It's pretty equal.
Yeah.
But it's cleared up a lot. Okay, you think you can tolerate more ultrasound?
Yeah, I can.
Okay. And then there's the paravertebral lymph nodes. There's a pair of them on either side of the vertebrae. And there you go. They just absorb the fluids in the regional lymph nodes, territories. When you do shower, you can pump the lymph nodes while you're soaping up.
Okay.
And do at least 15 times.
Okay.
And while you're waiting for your water to get warm, not hot,
She's so hot.
lukewarm.
She loves it scalding hot.
Oh yeah, no, you're gonna heal so much faster if you don't do that. Then you can use your gloves or dry brush before you hop in the shower.
Okay.
I'm going to use the contouring gel. The ultrasound will drive that product in deeper.
Oh, okay.
And so again, from like the navel area to the rib, all of this area wants to flow up to the armpits and across.
It's gonna be
And
a
then
very
everything below that
informational
wants to come
video.
around to the front.
Yeah. It's gonna be a great video. Lots of information.
I'll make sure I send you a copy too if you want it for your own, just, information.
Oh,
This
okay.
is so informational.
Or like that, be nice.
Think that they're okay with it, but oh yeah. So
Yeah,
many
YouTube,
people
you would go, yeah.
See, I used to have an access television station show. It was called The Art of Healing.
Oh wow.
And I would interview local doctors or, hyperbaric oxygen therapy with a neurologist, and I would go over the lymph system. And so it was fun because I could interview anybody I wanted to that was
Right.
willing. And then they had like the whole crew of people there. But I think it's part of that Silencing America. They've shut down all the access TV channels.
Because
shows.
everything's YouTube now.
Yeah, because everybody's doing
everything's YouTube and being censored.
and doing it yourself, and
But Anyway, that was the archaic days. I used to give overhead projection presentations. Then I went to slideshow presentations, and then now computer, laptop,
Right.
PowerPoint.
Right.
So I've been doing this a while.
You are definitely a teacher. This is great. A lot of people just really they don't know how serious it is to just even besides it being just cosmetic, just getting massages and different things.
Oh
How
yeah, and
beneficial
people
it
think,
is for
oh,
their
I'm
body.
just frivolous to do. It's like, no, it helps with healing. And the lymph system is your immune system. It's the garbage collectors, and it hosts immunological responses. So it's overlooked quite a bit in the health profession. We're just getting more attention now with the immune stuff, but it's, the garbage collectors, and it purifies the blood. So it's got to, it's nice and cool. Yeah, but it just helps. So it's a magic wand, and it helps with the pain sensation. It changes the texture of the tissue underneath right away. You can see how swollen she is in her low back.
Yeah, I really can.
It helps stimulate collagen and elastin.
And once all that go down,
And it, what I found too with stretch marks is that after about 3 sessions, you see a noticeable improvement of the appearance of the stretch marks. It's stimulating the collagen and elastin in that area.
Do you do like the Brazilian butt massages too?
No, I don't. I just stay away from that. Don't touch the fat. Let it do its thing. Other people do that. I mean, after.
Can you use that same device on that, like on just your butt area too? Or
Not for the BBLs, because you don't want to make the fat explode.
Oh, got it.
Okay, it's cause cavitation. It heats it up and it makes it explode, and the body carries it away. So, no, we don't touch the fat. Oh, I'm sorry. It's a little tender there. It's very swollen there. So make sure you put your garment on, and it will press the fluid out of the tissue into the lymph. The lymph's all ready to receive it. When there's trauma to the tissue, an injury like sprained ankle or surgery, the lymph system has a safety valve mechanism where it starts working overtime, and it pumps and pumps and pumps and pumps, and then it's like going to the gym and you do so many reps, you get muscle fatigue, and you can't do one more stroke. So then the lymph system goes, I'm exhausted, and then, okay, we're done. We kind of helped with the trauma of that, but now we're kick-starting the lymph system to start pumping again and clean the filters, bring out the sponges, and then it gets it excited and moving again. can see why I was like, oh, an hour is just not enough time to. Post surgery, I usually book an hour and a half to be thorough. Once we kind of get the major stuff done, I can get it into an hour. But usually the first time with all the questions and explaining and okay. I'll let that just get kind of sticky. Now you're wearing a backboard.
I'm wearing a backboard and a stomach board.
And you have foam, and you get that memory foam. And the more compression, the more layers, the better. And you feel, people say they feel more protected if they're bumping into things.
Yeah.
Bumping into doorways.
Okay.
I was like, oh, I didn't.
My son is like big on patting now. He pats all harder, he'll run up against me. He's so cute.
Yeah, you don't scar very well. I sometimes use scar gel, and I like this Walgreens brand Band-Aid, the hydrocolloid gel bandages. I wear it watertight, and you can put that over the stitches and the incisions, and they stay really stuck. Just use a little witch hazel so the skin's clean.
Okay.
And put that on, and then the it just everything heals so nicely. And when, especially when they take the stitches out, bring Band-Aids with you, and just ask them to put that on there.
Okay.
And so all the studies show too that when you have a Band-Aid over a scar, it heals
Better.
cleaner.
Guys, you definitely need to come to Oracle Massage Lymphatic Therapy. Okay. She did so amazing. Like, I'm literally leaving here in no pain. Like, I was in so much pain. And I'm so happy with the results. You guys gotta come. Do not forget to get your post-op massages. This is the very end video with so much information on why it's so important to get these. Please, please, please. Please get them. Okay? Let's go. Thank you guys for tuning in. Make sure you like, comment, and subscribe to my channel. I'll be posting all these procedure videos, kind of changing my YouTube around to more procedures and things, cosmetic and things that I like to get done. So make sure you like, comment, and subscribe. Thank you so much. Get that one out of the way. Okay guys, make sure you come see Susan at Oracle Massage. I feel 10 times better, guys. Make sure you get your results. I feel so good. Oh.